This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Hey everyone, welcome tonight. We want to say thank you to PM&R Scholars for having us, and we want to welcome you to University of Missouri. I mean, I remember when I was a medical student and taking a look at these programs and going through PM&R Scholars, and it was so, helpful. And I think that it's a great event, and, however the match works out, you guys pick the best specialty, and we just want to tell you that, what we love about our program. All right, so we have our leadership here with Dr. Finkel. She's our residency program director. She's been involved nationally with, AAPM&R, and so has Dr. Todebush, and he's our associate residency program director. Dr. Finkel leads our TBI program here at Rusk, one of our locations and sites that we train at University of Missouri, and Dr. Todebush is our sports director. He really lets us, do a lot of things with procedures. So we'll talk about that in a little bit as well. And here's a little bit more of our faculty. We have a wide variety of faculty with lots of different interests. We're very lucky to have Dr. David Arnold. He is the executive director of the Next Gen Precision Health Initiative. So it's a lot of research that's going on here. University of Missouri is really investing inside of our department, doing a lot of research with SMA, a lot of musculoskeletal research. And, if you want to do research here, it's a place to be because it's really building up within the last few years, a lot of faculty hires with research as well. And we have Dr. Burris as well. He's our department chair and, leader of our amputee program. He is nationally world known, for his amputee care, and he's, writing books, chapters. If there's anyone to learn from, it would be him. And we're very lucky to have him here. We have Dr. Jamalski. You'll see him in a lot of spine, MSK clinics. We have variety with consult as well. You'll see Dr. Edwards, Dr. Shaw, and also Dr. Farmer. She's one of our very own residents who just graduated this year, and she'll be starting, just next month. So we're really lucky to have all of them here, and you'll get a variety as well. For our peds doctors, we have Dr. Emerson, Dr. Farad. It's great to have them, and they're pretty funny people, so you'll really enjoy that as well. We already mentioned Dr. Finkel and Dr. Todebush as our program leadership. We have Dr. Jones. He's a wealth of knowledge. And, what I really enjoy about working with all of our attendings is that you can really sit down and you feel amazing, working with them. And you feel amazing working with them and being super friendly with them as well. And then we have Dr. Vavante Jones as well, who's a part of our stroke program. All our program leadership are excellent, and we'll keep on talking about them as we go through the presentation. So as for the residents, we have our fourth years who are here. So we have Dr. Kotomi Obayashi and also Dr. Jake Tramatullo. They're leading us from the chief resident side of things. We have Kotomi working with us on chief resident of research. So if you have any questions for research, feel free to reach out what's going on and what we're doing. Also with Dr. Tramatullo, he's our chief resident of administration. So if you have just any questions, in general about the program, feel free. And then we have Dr. Van Doren, director of patient safety, and Dr. Braultz, director of quality. And Dr. Braultz just had a baby. So this is a really, family-friendly program as well. So he's, taking some time off, spending time with his loved ones. So we're always happy to see, the family aspect of our program. And then you have us tonight presenting you from the PGY3 side of things. I'm Rafid, and we also have Andrew and Ben here, and David, he's the last one of our group. So it's a really great group. We all hang out. It's a really fun time. And we have our new PGY2s with Dr. Dreyer, Dr. Finneman, Dr. Schwartz, and Dr. Wacker, and our new PGY1s, that are coming in. One great thing about the University of Missouri program is that we have a separate, PGY2 through PGY4 years. You can do a prelim year here at University of Missouri, but if for any reason you'd like to do, a prelim year anywhere else, it's a great option and opportunity for you. We have Dr. Eisenman. He's right now at the University of South Dakota. Dr. Johnson, who is doing her prelim year here, as long as Dr. Malik, who's at the University of Missouri, and Dr. Rogers, who's doing his prelim year at Arkansas. So we're pretty varied. We have lots of different hometowns and right across, the United States, East Coast, West Coast, South, anything you can name it. And the medical schools are a little bit concentrated inside of the Midwest, but we interview people from all over. So apply if you, love our program and you like what you see tonight. We're happy to see you, and all you guys deserve to be here. So there are a few training sites that we go through. We also our main inpatient rehab is at Rusk Rehabilitation Hospital. That's where we do our, inpatient training inside of amputee care, traumatic brain injury, spinal cord injury, stroke, and just general debility. And you get a lot of great training from our inpatient attendings. And then we rotate at University Hospital. That's where we do, the consults. We're working with, medicine doctors and, doing a lot of things from there, trying to send over our patients, hopefully to Rusk, and, see them in the inpatient side of things. And then we get a lot of procedural experience. We'll talk about that, the numbers specifically a little bit later, but that you'll see at MOI. That's where Dr. Todebush is, Dr. Dramalski, and a lot of the other ones. And Harry S. Truman, that's the Veteran Center. So you're able to get a lot of different practice sites and locations. And I think that's one of the great strengths about our program, just because, when you're going out and you're going to start your first job, if you're a general PM&R doctor, that's something that's positive on your CV, that you've been working at a, great tertiary care hospital. You have inpatient rehab that's standalone. So you have an idea of what resources that are there, how can you manage the patients, and you get a lot of experience about if the patient is really sick, where they need to go and, when to send them out. And we also have Harry S. Truman as well for the procedures. And then some other rotation highlights, just how we talked about earlier. So focus on PGY2 inpatient, and then outpatient is more PGY3 and PGY4. And since we don't have any pain fellowships here or sports fellowships through the PM&R department, we do have one through the family medicine department, but no competitions for the fellows. You're getting a lot of procedural experience. And then this is how our sample schedule is kind of set up. So we're a little bit more heavy on the inpatient side, but it's great after PGY 1 year with all your medicine experience, being able to go through and, get that done early. And then you transition more to the outpatient EMG, pediatrics, and elective rotations. And our outpatient rotations are listed here. So we have different ones, Rusk 1 through 3. Rusk 1 is more so looking at our general outpatient, stroke, amputee, spinal cord injury, and brain injury care. And then Rusk 2 is more pain for those who are really interested in pain fellowships. It's a great rotation, working with Dr. Varghese and Dr. Dramalski. And Rusk 3 is all the sports type things. And the VA is a combination of those. So here are some of our procedures. Here are percentile ranks. So like we said, because we don't have the fellows, you're first in charge. If you want the needle, you got it. And if you don't want it, that's okay too. So we have greater than 75th percentile for a majority of the ACGME procedures. The only one really that we don't have is other procedures, but as you can see, EMGs, axial epidural injections, all the way trigger point injections, and ultrasound is a big thing here. We even have ultrasound didactics that you can do when you're on your outpatient rotations. And our salaries are right here. So you can see that we have pretty good salaries, and every year it's going up, and it's inexpensive to live here. So you can really go far with your salary. We have access to a local airport and then 2 major airports either way in St. Louis, Kansas City, but you don't have the prices of those cities as well. And it's a college university town here. So you have, really good food, a lot of entertainment options, and we get free lunch at work as well. All right, and now I'll transition over to Andrew talking about research.
Hey everyone, my name's Andrew Goldblum. I'm a PGY3 resident here at University of Missouri.
With regards to research in our program, we do get a lot of support in department funding for conferences, so long as you have some kind of presentation there, which we do a very good job of. As you can see, these are just our current fourth years doing poster presentations in a variety of settings, whether an actual poster, an e-poster, as well as Dr. Trimatula giving a podium presentation at AASSM. One really big thing here that we're very excited about is, as Dr. Rahman kind of mentioned earlier, is we just opened a huge next gen research center led by Dr. Arnold, who is part of the PM&R department. It's very cutting edge in terms of that, and we definitely have a lot of access to newer research ideas and having the support staff to have residents be involved with that. As Dr. Rahman also mentioned, Dr. Obayashi is our senior resident research director and our chief in that regard. And we do view here research as part of our curriculum, and it is required at some point, whether it's a local, regional, or national meeting, that you will present something, as well as being a part of a QI project. So a lot of really awesome and interesting things are happening here. Here you kind of get a variety of different pictures of what we do. Up there in the top, I'm getting letting some of my co-residents practice their EMG skills on me and kind of getting used to using that. In the bottom right, we do some cadaver labs, especially for ultrasound-based injections, as well, and just learning our general anatomy. In the bottom left here, we have a robust amputee program that was mentioned before, and so you can see some of our residents working on wrapping and knowing how to properly do that. And in the bottom left, one of our previous fourth years from last year, Dr. Rowland, who matched Payne, this is a picture of him getting to leave a little bit early because he wrapped the baby limb so well. So we do like to have a lot of fun here, even when it's more of the didactic training. We have a plethora of extracurricular activities. As Dr. Rahman mentioned, we do have that MSK ultrasound course. And honestly, a good majority of our attendings, if we say, hey, can we go in and scan first, they let us do so. And so we can get used to using the machines, as well as aided in our diagnosis. We, as a residency program, there's a free MSK clinic. A lot of the times it is led by one of our attendings, usually Dr. Toto Bush and other people sub in. We do volunteer there once or twice a year and kind of work with med students as we help them progress in their training of interacting in patients with an MSK focus. We do Friday Night Lights coverage, and so people can go to multiple football games, as well as injury clinic on Saturday mornings, which is also fun. We do cover wheelchair basketball. We just recently really expanded our sports sideline coverage because we've now partnered with the Mizzou Rec Sports, such as like myself and one of my co-residents, we did a Mizzou sideline coverage for the Mizzou Club men's sports team. There's no official varsity team here for that sport, and so the club team is kind of that level. So you do get to do a variety of things. We have had opportunities to cover fencing tournaments, rock climbing, and we do sort of a para sports day where we can introduce both patients and other residents into how we can integrate patients that we see with disabilities and keep them active and in sports. So that's very exciting. And like Dr. Rahman said, it's very customizable. We can definitely, our program is very willing to accommodate whatever your interests are. And so that's a really awesome opportunity, especially with some of our attendings, such as Dr. Washburn here holding the belt. He also does do work with USA Men's Soccer. And so we do have a really robust extra educational opportunities in that aspect. One really cool thing is with regards to fellowship match, we can say very proudly that in the last 10 years, every person that has wanted a fellowship has matched in the fellowship that they wanted, or has gotten the fellowship that they wanted. And so that's been a very exciting thing, and we're very excited for some of the fourth years to hear back in this match cycle. Now, with regards to Columbia, it is literally smack dab in between Kansas City and St. Louis, basically drawing a straight line across the state. You're about 2 hours from either of the major cities with airports, good barbecue, good food. Columbia itself is a really awesome town. It is definitely a college town. I'd say probably about, when the college is in session, probably about 130, 140,000 people are here. It is centered around the university, and so downtown, it is very manageable from the tip of the point of Columbia to the bottom. It's about 15 minutes in total, so everything is within reasonable driving distance. There is a lot of fun things to do here. Some famous comedians come in. There's some music festivals. It's a very exciting scene, as well as really good food. That is something that I very much care about, and so we've been very surprised and blessed to have some of the food here. And so it's a really nice place to live, and especially on a resident salary, as Dr. Rahman mentioned, we have a very nice cost of living, and so it's very family friendly, a lot of outdoor parks, and so there's a lot to really do. I personally love going to the farmers market on Saturday mornings and Wednesdays, which is year round, which is rare, so that's very nice.
We got about 2 minutes left.
Here are just some quick pictures of some of the things that we like to do together. Some people go into Mizzou football games. We had in the bottom right some volleyball club leagues. And so we definitely have a very close family feel here at Mizzou. Some more activities of various things. We do an amputee golf day. We work very closely with our prosthetists and orthotists. And this is just a fun little thing. Wouldn't be Missouri without some tractors. And so our residents have done like a tractor race, and it's a very fun and family friendly event. So our motto is rehab like a champion today. And here are some pictures of the campus. And here are some emails for anyone that would like to reach out. The PGY 3s who presented tonight, as well as some of our leadership and our chief residents. And so I think that pretty much concludes everything.